Alrighty, hey guys. So welcome to the first video of a few. I don't think I've fully decided how many videos there will be yet. But we're pretty much just going to go through a bit of an overview of cancer and what role exercise has to play in it. Obviously, with all of us being EPs, this is our main area of expertise, but probably an area that isn't touched on a whole lot at uni. So a lot of the information might be new to you, or you might have done a few PDs in previous. But yeah, so we'll get started. So I guess we'll start off with what is cancer. So it's pretty much a disease where abnormal cells divide and destroy body tissue. So that can happen in pretty much any area of the body, from soft tissues to organs to bones. There's heaps and heaps types, but the most common are breast, prostate, lung, and colorectal. Of all of the types of cancers, there's also stages. So stage 0, 1, 2, 3, 4. And you can see on the slide here, stage 0 is where there's some abnormal cells present, but they haven't started to spread. So it's very localized in one area. Stage 1 is where this cancer is still quite small, but it's only spread to nearby tissues. So it's not in the lymph nodes, it's not metastasized to other areas. Stage 2 and 3 kind of are identified by the cancer being a bit larger. They have spread to nearby tissues and the lymph nodes, or the lymph nodes, but it's not all over the place. And then stage 4, as we've probably heard about in other scenarios, it is the most progressed version of cancer. So it has metastasized to different areas of the body, not necessarily local. And obviously within these stages, that can all look quite different depending on the patient and the type of cancer. Oh, next. But that all being said, exercise should be a very utilized treatment option for cancer patients. It's been shown to improve the severity of treatment side effects considerably. I'm sorry, I don't have a direct number or percentage, but as a background, if anyone doesn't already know, I currently work in the cancer space as an exercise physiologist, and I can see firsthand how much exercise can improve the fatigue side of things, pain, all of the things that we're all aware of as EPs in the return to work space primarily. Exercise is super important in all of those areas with cancer patients as well. Next, it can also improve cancer survivorship by 25%, which pretty much every cancer patient I've ever worked with, that's their number one goal, is surviving their cancer, surviving their treatment, because quite often the treatment is the real kicker, the thing that really wears patients down, gives them a lot of bad side effects, which then comes back to point one, but that survivorship is a big thing for them. And then finally, reducing recurrence by up to 45%, which is a pretty significant statistic, but also another huge goal for cancer patients, because once they've been through all of that once, they really don't want to have to deal with it again. So we'll go through all of this in a little bit more detail as we move forward, but those 3 points are the main ones that we explain to patients, and they're the ones that have the most research backing behind them. So I think if any of you ever see a cancer patient in future, whether they're right at the beginning of treatment or they've been in remission for years and years, highlighting how important exercise is purely on its own to achieve all of these points, I think would be, or I know is a very beneficial leeway and kind of a selling point for exercise if they're not already. Now we'll go into the key goals of exercise for cancer patients. So what I do at my other clinic is we kind of label it as exercise medicine dosage. So we almost liken it to a chemo dosage or a radiation, where A patient isn't going to not rock up to a chemo appointment because they're not feeling great. I mean, in some scenarios that can happen, but they're not going to reduce the amount of chemo they have because that's seen as their medicine, the treatment for their cancer. Exercise is and should be labeled the same. Not saying exercise is going to replace chemo or radio. Don't tell that to your patients, but it's quite important for all of the reasons we've talked about previously to look to achieve the full minimum recommendations if we can. That being said, as we all should know already, exercise should be very specific and individual to the patient. So yes, these patients will have cancer, but quite often they'll also have comorbidities. So that can be all of the ones we're already aware of, anything cardiac, neural, etc. Often there can also be more comorbidities due to cancer treatment. So there's a lot of areas, pre-existing, post-treatment, etc., that we need to be aware of. And the typical thing that we always see is how much exercise they've done previously. A lot of cancer patients we find are in the older age group. So the age group where potentially exercise or structured exercise, like we recommend, is not as common. It's always been, oh, I've got a busy work life. I'm very physical at work. I don't do exercise in that sense. So looking at what they've done previously, especially in the cancer space, is going to be very important, because what fatigue we feel or the typical kind of musculoskeletal injuries that we see typically at NP, it's very different in the cancer space. That fatigue, that lack of exercise tolerance is tenfold. Next, a big point that we have to do is educate the patients and their families of, yes, the benefits of exercise, but that they can be very safe to exercise with the correct supervision, which would be us as EPs. So there is that common old-fashioned view of, if you have cancer, you're bedridden, you're resting, you have to stay in hospital, in bed, at home throughout that entire treatment. And that's not the case. Obviously, they have to be careful in terms of being immunocompromised and staying safe, not going, potentially on overseas holidays every week. But they need to be aware that exercise can be completed safely, and under supervision, they're going to get a huge benefit from it. As we said, already kind of working from the patient's current capacity, as you can see in the table down below, the weekly minimum recommendations, it's actually quite a bit. So they are in line with the Australian physical activity guidelines. So we're looking at cardiovascular exercise. It says fitness, it should be exercise. 75 minutes of vigorous intensity or 150 minutes of moderate intensity per week. You can also complete a combination of those two, as well as 2 to 3 days of strengthening exercise, which at my other clinic, we've kind of fine-lined that down to about 380 repetitions per week. So 3 sets of 10 equals 30. When you look at that as, ourselves, who are, I would assume most of us are quite active, it's still quite a bit of exercise. But then also a patient who hasn't exercised previously, who has this older fashioned view of cancer means you need to rest, and all of their symptoms are leaning towards, that's the last thing I want to do. You want to stay in bed, you're not feeling well, they could be feeling nauseous, very lightheaded, all of those things. They're not very encouraging to the patient to want to get up and exercise vigorously, let's say. So that's where we come in to do the education side of things and start them off lighter if we need to. So quite often I'll see a patient who is in the midst of their treatment, going through hell and back pretty much for their chemo. Hemoglobin can be low, lots of things working against them. I'm not going to sit them down and say, all right, now you need to exercise vigorously for the next hour, because otherwise you're not going to get your exercise medicine dose. That's not going to be beneficial, but educate them on what we're trying to achieve and what we're going to build them up to, and start off moderate, even light, and doing seated exercise depending on their limitations. Quite often, in my experience, someone who's going through a cancer diagnosis or a cancer journey are going to be very on board with anything you have to offer them that could help them. So try to be, as we always would be, as encouraging as possible, and explain that it doesn't have to start off straight from the gold standard. We'll work with you to get you there. And that's obviously going to be a bit up and down as treatment changes as well. Alrighty. Back onto the kind of targeted exercise based off cancer, or the patient specifically. There's 3 very big areas we look at, but we're going to go into a bit more of a deep dive of that after. But the 3 main ones being cardiovascular health, muscle mass, and the psychological benefits. So these can be very beneficial to educate a patient on, but also just have to have in the back of our heads of, all right, we're trying to achieve this dosage of the 75 minutes of vigorous, etc., and then some strength. But what are we trying to get out of it, or what are we looking for in a precaution? So cardiovascular health, it includes cardiotoxicity, which can happen from a range of different treatments, especially some chemos and radiotherapy, especially if it's to the chest wall, particularly with breast cancer patients. If they've got reduced fitness since or prior to their diagnosis, and then the general decline with cardiovascular fitness as people get older. So the biggest population of cancer patients at the moment are of the older generation. So considering all of those factors that impact the older generation in Australia, along with a cancer diagnosis, which then exacerbates all of those things. Next, muscle mass. So sarcopenia and cachexia are very common in the cancer space, and sarcopenia also being more common in an older population. So we want to make sure that we're trying to gain muscle mass, elicit that muscle growth response. Again, quite a few patients will experience a loss of strength and weakness in their muscles as a result of treatment. And then again, in their joint pains related to some medications. So you'll come across quite a few if you do work with cancer patients much in the future. But there's one in particular that's used a lot for breast cancer patients. And a lot of the time they'll get pretty severe joint pains for up to months, sometimes a greater part of a year, which obviously when that patient's experiencing quite a bit of pain, it's going to be the last thing what they want to do is exercise. But in a sense, the exercise is going to make them stronger, avoid more loss of muscle mass, etc. The tricky thing is it's not going to get rid of those aches and pains from that particular treatment. So it is important to kind of set expectations in a way. And finally, but definitely not last, psychological benefits. So again, an area that we'd all be really, really familiar with, but there are huge psychological benefits from exercise, especially at a vigorous intensity, those endorphin releases, etc. But also a big thing that I hear from patients that I work with is it's the only form of treatment that they can actively engage with. It's not happening to them. It's not sitting down in a chemo chair, having a needle in your arm for the next couple of hours. It's you rock up, you get to actively participate in something that's going to benefit you as a form of cancer treatment. And that can be extremely empowering for patients that are going through such a tough diagnosis and change of lifestyle. So that's the end of the first video. So hopefully you kind of have a good overview of what cancer is, and kind of the main education points. Next, we'll go into a bit of a deeper dive of some of the precautions.